Are you struggling to understand or support your loved one living with dementia while they're in hospital? I'm Ann-Helena Cherwick, behavior therapist at the Ottawa Hospital.
And I'm Margaret Mackenzie Neal, dementia behavior support nurse.
By the end of this video, you will know what some of the common responsive behaviors and feelings are, why they happen, and how you can support your loved one while they are in hospital. Let's get started.
Dementia is a condition that affects the brain and damages brain cells. It can make it harder for someone to remember things, make decisions, or understand the world around them. It can also affect how they feel and act. People living with dementia may show different behaviors or have feelings that can be challenging, especially in a new place like the hospital.
Sometimes people living with dementia have what we call responsive behaviors. Responsive behaviors are actions that people living with dementia may do in response to something happening within or around them. These behaviors are often a way for the person to show that they are feeling upset, scared, or confused. They may not be able to explain their feelings, so they show them through their actions. Some common responsive behaviors include agitation. This is when someone becomes upset, restless, or fidgety. They may be pacing or moving around a lot.
Aggression. This can include yelling, hitting, or pushing. It's important to remember that the person is not trying to hurt anyone on purpose. They may be aggressive because they are feeling scared or confused. Exploring or exit seeking. People living with dementia may want to walk around or leave the room. This is often because they feel lost or unsure of where they are or what they should be doing. Repetitive behaviors. People living with dementia may repeat a word or action over and over. This might be because they are anxious or looking for comfort.
In addition to responsive behaviors, people living with dementia might also have psychological symptoms. These are changes in how they feel or think. Some common psychological symptoms are depression. The person may feel sad, lonely, or not interested in things they used to be. Anxiety. The person may feel very nervous, worried, or afraid.
Hallucinations. Sometimes people living with dementia might see or hear things that are not real. Delusions. This is when someone believes something that isn't true, like thinking that someone has stolen from them or that they are in a different place. These symptoms can be very difficult to understand, both for the person living with dementia and their family or caregivers. But remember, these behaviors and feelings are part of the illness. The person is not acting this way on purpose.
There are many reasons why someone living with dementia might have responsive behaviors or feelings. Some common reasons include pain or illness. If someone living with dementia is in pain or feeling sick, they might not be able to explain it, and it might make them act out and become more confused.
Changes in the environment. Being in hospital can be very confusing for people living with dementia. They might not understand where they are or why they are there. Feeling frustrated, scared, lonely, or bored. The hospital can feel like a strange place. The new people, loud noises, and changes in routine can be upsetting for people living with dementia. Unmet needs. The person may not be able to explain what they need, such as food, drink, sleep, or the need to use the toilet. All these reasons may make somebody living with dementia have responsive behaviors or feelings.
Fortunately, there are many ways that you can support your loved one living with dementia. Stay calm. If your loved one is showing responsive behaviors, speak in a soft, gentle voice. Avoid correcting or reasoning with them. Ask them what is bothering them. Your calmness can help them feel understood and more relaxed.
Try to understand. Think about what might be making your loved one upset. Are they in pain? Are they scared or confused? Understanding the cause of their behavior can help you and the healthcare team respond better. Provide comfort. If your loved one is feeling anxious or upset, offer them comfort. Reassure them by holding their hand, sitting with them, or playing their favorite music. Bring in familiar items from home like photos or a favorite blanket to help them feel more comfortable in a new place.
Give simple instructions. People living with dementia may have trouble understanding complicated instructions. Try to use short, simple sentences and ask one question at a time. This allows them time to process the information. Stay positive and be patient. It may take some time for your loved one to adjust to the hospital. Be patient and try to focus on the positive things. Understand that it's not their fault if they are confused or upset. Offering praise for small accomplishments can help lift their mood. Now let's hear from Sonia, a caregiver and wife of a patient with Alzheimer's, as she shares her firsthand experience.
Hi, I'm Sonia Disher. My husband Steve was diagnosed with early onset Alzheimer's at age 50. And at that point, I became not only his wife, but his caregiver for the next 6 years until he passed away. Steve worked in the military on helicopters and he loved his career. And we were able to use that to our advantage later on when he was in long-term care or in the hospital. For example, in long-term care, they wanted him going to the dining room and he didn't want to go. So I had got permission to use his warrant officer's name. So they said, Steve, warrant officer so-and-so just called and it's time to go to the mess. And he went in immediately. I had a blanket made with pictures of our family and his hobbies on, and we put that in the long-term care and also in the hospital to make him feel comfortable, something familiar. And it was also a great tool for anybody visiting or the staff to get to know him. They could point to something and there was a conversation starter. I also had a little brag book that had pictures of our family with their names underneath and his hobbies like fishing and golfing and hunting, and a picture of the helicopter. And they could use these as starting points, point to it and start talking. When your loved one is in hospital, it's so important to have a conversation between the staff and the loved one. We want to know what they're being given for medication. We want to know what it's going to do, what side effects, what adverse effects could happen. For example, one of the nurses came in one day when he was in hospital to give him an IV. I didn't ask why he needed the IV. I just assumed it was an antibiotic or something. And they were giving him the IV, but Steve had myoclonic jerks at that time. And she would just get the needle in and he'd have a jerk and it would pop out. So after the second try and it popped out, I said to her, you've got one more chance because he's getting agitated. He doesn't know what's going on and it's hurting. So she said to me, would you be able to get fluids into him? So this was just to get fluids into him, not a medication. That should have been the starting point. Anytime that we can use conversation and avoid medications, that's the preferred route.
One of the most important ways you can help is by working closely with the medical team. If you notice a sudden change in your loved one's thinking and behavior, don't hesitate to speak up. You know them best. They might need extra attention, special tests, or an adjustment to their medication to help with dementia-related symptoms. Your voice matters, so be sure to share what you see with their care team.
We hope this information helps you understand responsive behaviors and psychological symptoms of dementia. By working together, we can help your loved one feel more comfortable during their hospital stay. Please remember you are not alone. The healthcare team is here to help you every step of the way. Thank you for watching.